Set. One of our people.
Haiti's unique. Haiti's unlike really any other place that I've been, and it's hard to explain to people.
We got here and I literally had my mind blown.
And I could tell people stories. I could show them pictures. I could even show them video. But it doesn't capture what Haiti is. Haiti's a dichotomy.
The living situations here in this country is just completely devastated.
It's also full of happy people that have hope, people who are content with little or content with nothing.
A lot of these people have no care.
These people have so limited access to people that can pass on a little bit of knowledge and a little bit of help.
You know, we take for granted at home that we can pop into the cupboard for ibuprofen. You know, they have nothing. And so when you get someone very sick, you know, they die. You know, that's the reality.
Health care, that's the biggest problem we have.
I know there's a ton of need, you know, out there. And Haiti might be one of the areas that needs it the most.
They want to be loved, and they give you way more love than you receive.
So appreciative of everything that we gave them, whether it was a Band-Aid or a Tylenol or an antibiotic or something for their hypertension.
And you could feel their love in return and their gratefulness.
So much gratitude and purity.
It's full of people who want to do good. That dichotomy is reassuring, it's reinvigorating.
When we come here with the supplies and the tools and the knowledge, we can help them change themselves.
We brought 16 people to where that they are not comfortable.
And I was working the full week before, basically finished work, got on a plane in airports for 12 hours.
We saw in this week that we were here about 800 or so people between a dentist, vision, medical.
We went to 4 locations.
4 different communities over the course of 5 or 6 days.
I mean, I've been practicing for 25 years, but to be honest with you, I was very nervous. Even when I was here, I was nervous that how do you bring all the right equipment?
5 people in a small car, travel for 5 hours through rough roads. Finally arrived at the makeshift clinic that we had. Over 100 people sitting in this cramped little room. That was when it first hit me, you know, the impact of what we would be doing here.
This is my 5th humanitarian trip this year. I can tell you from being all over the world, Haiti has needs unlike any other place I've experienced.
And it was chaotic and it was crazy.
2 events that were tied closely together. 2 babies, 6 months old and 3 months old, had obvious pneumonia. If they came into my emergency department, I would immediately admit them to the hospital, put an IV in, start them on antibiotics, and still be concerned. Here we have none of those resources, but because of our team, we saved babies' lives this week.
So to be able to clean teeth that had never been cleaned before, teach them that their gums can heal and that they can save their teeth was life-changing. It is true that everybody smiles in the same language.
Some of these people have nothing, but they're still giving us what they have with both hands.
I think the biggest thing I've learned is, yeah, we're here to change lives, but a lot of times those lives that are changed are our lives. We can go home and make a difference.
The truth is that won't change my life, but for parents and especially the individual child, their life is saved, their life is better, and their life is different. That will change my life. That will make me come back to Haiti again. It'll make me want to dedicate more time to be able to try to save and change more people.
At the end of that day, even after having not slept for 30 hours, I felt the enjoyment that came from feeling like I had made a difference.
You know, if we can get more people on board to get down here and help these people, you know, it's going to make a huge impact.
Do good. That's what we're trying to do. As I say all the time, I just want to take care of more people better. And I think we're doing that.